So your patient has become very sick and you phone the intensive care doctor for help. Now, how does the intensive care doctor decide whether your patient is suitable for intensive care or not? My name is Sao. I'm a senior doctor that specializes both in intensive care and in kidney medicine. And in this video, I'm going to give you a sneak peek of what goes on behind the intensive care doctor's mind when deciding whether a patient is suitable for intensive care or not. I made this channel to cover topics that I think are not well taught in medical school or not well taught during medical training. So when I'm being phoned as intensive care doctor to decide whether a patient is suitable for intensive care or not, there are 4 factors that I consider. Now, the first factor is pretty obvious and it's patient factors. Our patient preference is obvious and I'm not going to cover that. What is less obvious is how I determine whether a patient is suitable for intensive care. Here, I'm trying to assess whether the patient has got the physical ability and the physiological reserve to survive and recover from a period of intensive treatment in intensive care. To do this, I've got to consider many different factors, including what illnesses they have had in the past that might impact their ability to recover. I'm also assessing their current physical fitness. In general, if a patient is able to walk up a flight of steps briskly without stopping, or able to walk a good distance up a slope of a gentle hill without stopping, or is able to walk a distance from one bus stop to another bus stop without stopping, then this might indicate that this patient might have the ability to withstand intensive care treatment. The next factor that I consider is the family, relatives, or next of kin. Now, theoretically, these patients know the patient best and should have the patient's best interest at heart. Speaking to these people is very important to confirm any medical information or confirm any patient's wishes, particularly when the patient is unconscious or confused and is unable to give you any of these information. And the third factor is medical personnel. And by that, I mean the doctors and nurses. As the responsible clinician that's looking after this patient, I will look at the active problems and issues that are causing the patient to be unwell, and using evidence-based medicine as well as experience, and decide whether the cause for deterioration is treatable or reversible by receiving intensive care treatment in intensive care for a period of time. Now, the last factor is justice and resources. Now, unfortunately, we live in the reality where bed, staff, time, medication, equipment are limited. Allocating resources to one patient, you might potentially be taking these resources away from another patient. Unfortunately, this means that as much as I would like to take all the patients that fit criteria to come into intensive care, I cannot do that. A good example to illustrate this is to look back at what happened during the COVID period, when we had more patients that needed to come into intensive care than intensive care beds that were available. This means the intensive care doctor will have to make a judgment call as to which patient will benefit more from intensive care treatment and take that patient over the other patient. Now, we'll still try to do everything in our power to try to help and support that patient that has not been accepted into intensive care. But it is the intensive care doctor's duty to make these decisions, and these decisions can be very challenging. Now, if you found this video helpful, watch this video here where I teach you how to transfer a patient safely, which I bet is a skill that most of you have not been taught. And subscribe to my channel for more insightful content. I hope that helps.